Hi, everyone, and welcome to #CArthritis, the terrific event that arthritis consumer experts host at the annual Canadian Rheumatology Association and Arthritis Health Professions Association annual scientific meeting ongoing right now, chock-a-block full of science. I'm so excited to have Natasha Trehan with us today. Welcome, Natasha.
Thank you so much for having me, Cheryl.
Yeah, it's really, I've been waiting a long time to talk to you, and I'm super excited that you're in the studio with us. Before we start chatting, let me give the audience a little bit of a hint as to who you are, where you come from, et cetera, et cetera. So, we are obviously at the Canadian Rheumatology Association and Arthritis Health Professions Association's annual scientific meeting. And Natasha Trehan is one of those young superstars in the making. Natasha is a translational and molecular medicine student at the University of Ottawa's Faculty of Medicine. She's passionate about patient advocacy, so that's why she and I are sisters from another mother. In healthcare, also in qualitative research, shared decision making, which is one of the themes of the meeting this year, science, innovation, research, and disability equity. If she has any free time, I seriously doubt that she does after that long list. She's either singing, podcasting, or taking a pain check, which is the name of the organization that she founded several years ago. So we are so excited to have you with us. Natasha, welcome to the studio.
Thank you for that long, nice introduction.
Listen, we're going to dive right in, Natasha. We're going to talk about what it is you're going to be doing at the meeting. And really, we want to focus at the top where I think all conversations start in the studio. And that's tell us a little bit about yourself. I gave that a very lengthy but powerful intro. Make it make sense to our audience. So, who are you? What do you do in your, I say, day job or day training at the University of Ottawa?
For sure. So I am a patient. So I actually live with juvenile idiopathic arthritis. I was diagnosed when I'm 13 years old. It's all over the internet, so it's something that I'm proud to say that now. But it has definitely been a journey and a struggle, but I think I've become a patient advocate now, not only learning how to advocate for myself, but others as well. So that's something that I do on a daily basis. I'm also a student at the University of Ottawa. It was in biomedical sciences, but they have a very cool program called translational molecular medicine, very research focused. So that is something that I do on a daily basis as a student in university. Navigating 6 courses while also being involved as a patient partner in research, volunteering for different organizations like Arthritis Research Canada, Pain Canada, Pain BC, lots of different things. And yeah, I'm very excited to be at this meeting just because I am wanting to go into the healthcare field as my career professionally, but I'm also a patient who's very passionate about rheumatology.
And an advocate, which makes you the classic triple threat. I love it. Thank you for that brief overview of kind of the who you are. I know that the workshop that you're going to be involved with, Natasha, really focuses on clinical practice guidelines and interprofessional shared decision making. I love the subtitle. It says everything, a journey towards health equity. So explain to our audience, Natasha, how clinical practice guidelines, in other words, how doctors do things or how health professionals do things the right way. So guidelines are to guide them, right? It really is as it says it is. How does that support shared decision making, and how does it move us towards health equity?
For sure. So that's a big one. And I think even when we're trying to make this presentation and how we're going to give it is going to be still very challenging because I think there's so much that you can cover when it comes to the topic of shared decision making. And then when you add in health equity, it's it's a never-ending list of how much you can do to improve the space. So for me, at least, what I think, and I'm bringing that patient perspective in when I am talking about shared decision making and health equity. And because I have my own podcast called Take a Pain Check, I've interviewed so many people living with rheumatic diseases from all over the world, from everywhere with different backgrounds. And I really realized that a lot of us patients, when we want to make decisions about medications or any other treatment options that we want to bring to the table, it's important that our healthcare professional knows about the choices that we want to make, but also our whole family is comfortable with it and the healthcare professional is comfortable with it. And so even that topic and having that conversation is very challenging. And that's why shared decision making even became a topic, because how do these different key players in my healthcare journey, how do they all kind of pitch into what my treatment options will be? Because at the end of the day, I will actually be the one taking care of myself.
Yeah,
Although my family's there, but at
that's
the end
why
of
we
the
call it self-care.
yes. So, yeah, I think what we are kind of working on is presenting some of those guidelines so healthcare professionals are aware of what is already out there in the literature, things like that. And then our intention is to bring in patient perspectives, patients like myself, and then we also have a couple rheumatologists that work with Indigenous patients that will be bringing in those perspectives on what healthcare may look like for them. And at the end of the day, we want to emphasize that it should not be any different from anyone of any background. You should be treating everyone the same.
Yeah.
But you should keep in mind that there are things that you need to consider that you may need to focus on based on some of the things that they may be worried about culturally. And so the same questions should be there in terms of treatment and everything because they do live with rheumatic disease. However, some people from different backgrounds may actually be so accustomed to things in their own culture. And for example, one thing that we will emphasize is that a lot of the times we think that the doctor should make the decisions. Like coming from a South Asian background and also other people from other backgrounds, it's usually not the patient that should have a say. Or if we're told we have a say, we're like, why are you asking me the question? I thought that's your job.
Yeah.
And so that's a big thing that we will be emphasizing at this workshop is that you need to kind of think about where people come from culturally and come up with a way to explain that to patients that, we can all make decisions and also figure out if they actually want to make a decision. I think that's the first thing. It's like, do they even know they can make decisions? And on top of that, are they comfortable or want to? Have you asked them about their preferences and values? So that's a big thing that we will be talking about, is really just focusing on those key questions that doctors should be asking and how to open that comfortable and honest conversation. Honestly, don't know if I answered your question.
Yeah,
Hopefully I did.
you did, and several of the others I have. That's fantastic. I wanted to know, our organization has been doing a lot of work on truth and reconciliation. We created the Arthritis Community Learning Circle where people can come together to learn about the calls to action to reconcile with Indigenous peoples on this land. And so when you're talking about how we make decisions and the cultural beliefs and practices that we bring into the clinic with us really matter. In fact, they probably matter the most because someone whose beliefs and practices are not even heard, let alone respected, shut off. There's distrust or mistrust, and that is natural. I mean, that's how I would feel. So Indigenous peoples often come into, an institutional setting, one that is not on reserve, it's off reserve in an academic center or a community center. And the people who are practicing medicine at those places are not always sure or even remotely knowledgeable about cultural practices and beliefs, whether they're facing a South Asian patient or an Indigenous patient. Um, how do you how do you help? How do you think your area of study, your area of expertise is going to help the new generation of clinicians coming into what I consider a new modern way of practicing, which is delivering on equity, right? Like if we don't deliver on equity and we don't focus on serving the needs of underserved populations, we're never going to quote unquote fix healthcare, right? So what's your view on that, Natasha?
I think a couple of things that we will be talking about specifically will be about kind of like the non-pharmacological treatment options versus the pharmacological treatment
Right,
options, and um, what patients want to talk about but may not be comfortable enough to talk about. The other things would be, how do we actually engage in conversations about treatment decisions? So there's certain things that we should be considering when we talk about it. And then a big thing about sort of like the future of what all this looks like is really, in my opinion, different shared decision making tools that are now coming out from some of these healthcare professionals that are doing research. One that I'm heavily involved in is like the JIA option map, and that's
right.
for patients living with JIA. And so that kind of lays out all the different treatment options, and then talks about like mood and stress and fatigue and other symptoms. And ideally, like at the end of all this, we want some of these tools to be put into place so patients, their families, and healthcare professionals can use that as like a guiding basis to make those decisions. Like maybe those tools will help them have those conversations if they're too afraid or not sure what to say. You'll have this application that you can use that will help you. So that's just one thing that I think we are currently working on in the patient advocacy space, as well as like we want patient partners to be involved in all these research projects, because having that perspective, you'll know what you need in terms of when it comes to shared decision making when you give your input on those things. So for me at least, like the future of all of this looks like having more patients involved in those research decision making things and from different groups. I think something that we also talked about is sometimes people are just more comfortable having a doctor of their own, the same ethnic background. Like maybe that'll make them feel more comfortable. So, like, how do you do that? And just like the different preferences, I think is so important. Um, but having that first step in conversation is the thing that will make the biggest change. If you don't ask them what their preferences and values are, if you don't talk to them about those things, lay out the options, then none of this will actually matter. And I
Yeah,
think that
yeah,
will,
I that really resonates to me. What we're talking about is being good, is practicing good human to good human. And having the color of the rainbow be in all of us. And I know that sounds maybe a bit Pollyannish, but I know that it's possible because we see it within our own patient advocacy community. I think the other really important thing that you've said is that people find people are at a state of readiness at different times, and uh, there should never be any pressure on a person who's going through a health crisis, a new diagnosis, to become the instant perfect self advocate. That's not going to happen. That's when we're the weakest and the most vulnerable, frightened, and a time for learning and a time for comfort. So we first want that from our healthcare providers. And that is something that healthcare providers need to understand. They need to know that we shouldn't just be thrown into the shared decision making deep end of the pool, that we have to ease our way in, put our toe in the water, and get a little comfortable with the temperature.
yeah,
So some of these things that we're talking about for our patients, for people that are living with a type of arthritis, whether it's JIA, something very well, RA, something I know very well. We all come at this in a different way and with a different toolkit at the time of diagnosis.
for
Um,
sure.
so yeah, I think it's such an exciting time because there are people pushing from all directions, Natasha, to make this sort of perfect world for people struggling with diagnoses or living with the diagnosis. There's a confluence of factors now coming together that will make a difference for people, both from the grassroots end of things, and as well from the clinical side. Let me ask you, when you think about your own journey, you've had juvenile idiopathic arthritis since you were 13. You to me, you look only 14. So, uh, but when you think about those early days, if you were to say, okay, fellow 13-year-old, parents of your fellow 13-year-old, what are the top three things you would say to a family right now who had someone like you at that time? What would you say to them? What would be your three pearls?
My first one would be things get better. And
Oh,
and I think that, and I it's just because at that age and kind of going back to the shared decision making, if a doctor would have asked me what I wanted, I would be so confused and
yeah,
lost. So I
yeah,
don't think that that's the right time, but I think the right time is the right time for, like, it's different for everyone else, like you mentioned.
yeah,
And at 13, I think my family and I, we were freaking out. We didn't know what arthritis was. Why do I have it? Let's try to find a cure,
yeah.
which doesn't exist. So there's just like, there's a lot of things that was going on in our minds. And I think over time that has changed in a
Things
sense.
will get better. I absolutely
Yeah.
love that. And it's
I
true in adult rheumatology as well.
Yeah, you get more comfortable living with it. You also learn new skills, meet new people, and that's the other thing. I think the second thing would be, find that community and support. And at first it was really hard for me because I don't know, kids get arthritis, but now
Yeah,
I've been in this space with my organization and podcast and engaging with other organizations, and there are so many kids that have arthritis. Yes, it absolutely sucks. Like, we shouldn't be having this. But there are so many people you can talk to now that you have this diagnosis. And I think that a lot of us don't know that there are people. And when I met people, it's so life changing. I can message them being like, "Oh, have you been on this? What has that been for you? Have you used anything?" Like, just mentorship. I think mentorship and friendship is something that I've built. Another thing, I guess the third thing I would say is, I think for me it's so personal, but this really shaped my journey and, my career path. Honestly, I have no idea what I would have done in terms of a career if it wasn't for arthritis happening to me. Like, now I know I want to go into the healthcare field, hopefully rheumatology. We'll see how that goes. But before that, just looking back to it, I think this really like shaped my life and gave me sort of a purpose to like help other people. So I would say those are the three main things that, and honestly, things do get better. Your life changes. You know how to like adapt with it now, change the way you do things. At 13, I was like, what is going on? My life is over. This sucks. I don't know what I'm gonna do. But that is so not true.
I love it. Things will get better. Find your people and let it be your guide in some ways. Let it be your life guide if you want it to be.
It doesn't
You
have to be.
use it. Use
Yeah,
it to advance your life, whether you go into healthcare or not. Find
yeah.
out where the pearls are in that number three and use it to your advantage personally, professionally. Those are dynamite. Wow, right off the cuff too. I didn't that question wasn't in the question set. I thought
I
I'd
know. I was
I
like, what
know,
am I
but
gonna
you
say?
handled it with incredible grace.
Thank
Natasha, I'm so thrilled that we had a chance to talk. I'm excited to see your own research work unfold. I'm excited about what you do for fellow people with arthritis. I'm one of them, so thank you for your service to community. I think it's so important that uh, there are it's not all happiness and sunshine and rainbows. You
Oh
and
yeah.
I both know that.
Mhm.
But trying to view things positively when you have not such a great disease is a real blessing. It's a gift. Try to always frame into the positive. And Take a Pain Check Foundation is there. Arthritis Consumer Experts is here. And as you mentioned, so many others who have really said, I'm all in for arthritis. We're here to help. At the end, we're going to share links, Natasha, to the foundation that you started, also to a few other resources, as well as to our own educational programs. We cannot thank you enough. We want to have you on again. We'd like to talk about what happened at the workshop because it hasn't yet taken place, but will shortly. So if you're game, we're gonna lasso you and bring you back into the studio if you're keen to do that.
I definitely am. This was great.
Wonderful,
Thank you so much
wonderful.
for having
Thank
me.
you, Natasha. I hope you have a great meeting, and we look forward to seeing you again soon.
Thank you.
Take care, everyone. Come back to another episode of #See Arthritis. Cheers.